Hey everybody, Dr. Hendrick here. I wanted to jump on here real quick and address some of the comments I got on my video yesterday, like this one from patients who were upset that I don't take health insurance, and explain a little bit more in detail about why I do not. If you don't work in healthcare, then you're not familiar with what goes on behind closed doors when it comes to taking insurance. And it's not as simple as you see your doctor, they submit billing to your company, and then they get paid. It just doesn't work that way. This year, like previous years, insurance companies across the board are cutting reimbursement to doctors. They are requiring more documentation, and they are implementing more quality measures and going to a value-based care system. So what are quality measures? This is a rudimentary list of different things that health insurance companies have decided that since they're cutting reimbursement overall, they will pay you a bonus at the end of the year if you meet these certain metrics based on what they tell you to do. So I want to go over just a few examples of different quality measures that myself and my colleagues have experienced over the past couple of years when it comes to taking insurance. One of them is if you're having a diabetic patient come see you. If the patient's A1C comes back greater than 8, you get dinged on your quality metrics. There is no consideration of can this patient afford their medication? Do they have type 1, type 2 diabetes? Do they have a pancreatic mass? The insurance companies do not care. They treat patients based on the number, and they ding the doctor based on the number as well. Blood pressure. If you come in and see your doctor and your blood pressure is greater than 150/90, that is also a quality metric, and that is why they will have you sit, repeat the measurement until it is under that value. I have even seen colleagues give patients clonidine in the office to get the blood pressure down so they're not dinged on their quality scores. I have also seen colleagues fire patients and list them as non-compliant when their A1C comes back greater than 8, and this is wrong. Other metrics include things like colonoscopy, mammogram, so if you don't go get these tests, your doctor is going to get dinged. When it comes to things like major depressive disorder, generalized anxiety disorder, if that diagnosis is on your chart, some systems will ding you if you do not prescribe an antidepressant to those patients. Not only that, but if the patients pick it up and pay cash and do not pay on their insurance, the doctor is dinged for that as well. If you have a patient come in with lower back pain and you want to order an x-ray of their lumbar spine, that's a ding. I give you these examples to say that this is why doctors are not wanting to take insurance anymore, because they are literally being told how to practice medicine by these insurance companies. They do not put patients first. You lose your medical decision-making capacity, and you are forced to follow these guidelines that really don't make sense, and they actually don't help patients.